Hello, everyone, and welcome back to the Sensitivity Doctor. Today, we have a very important conversation about fertility. This is something that personally I've experienced before. I think it was a huge catalyst that got me into doing trauma work in the first place. And so this is a near and dear to my heart conversation. I partnered up with Hillary Fredrickson and Dr. Kara Burke. Both these doctors are naturopathic doctors who specialize in working with some of the toughest cases out there of women and men in partnerships who can't get pregnant. And they have an amazing summit, which I'm so honored to be part of, that this conversation is going to be part of, the Cultivate Fertility Summit. And in this summit, you will have an opportunity to hear from so many different fabulous experts in the field. So if you're someone who's dealt with the constant trauma of not getting pregnant, losing pregnancies, watching other folks or other families get what you're hoping for and your heart desires and not being able to have it, this is absolutely the episode for you. Today I get to sit down with two fabulous doctors from Cultivate Fertility, and they have such open hearts for this. And we talk all about the integration of Western and Eastern medicine and heart center work and working through trauma that can sometimes interrupt your body's ability to do what it is designed to do. I hope this episode gives you some ideas of how to show compassion to yourself, your partner, and really the whole fertility journey. Please reach out if there's anything else you want to know that we didn't cover, because this really is an ongoing conversation and such a complex issue. Enjoy. Welcome, ladies. I'm so excited to have you here on the Sensitivity Doctor. And I know that I am also honored to be able to be part of such an important event that you've been putting on for 14 years now.
Well, it's our 14th episode. It's our 14th summit, and we've packed those into the last 5 years as Cultivate Fertility. But Dr. Kara and I have been working with patients as naturopathic doctors, fertility experts since 2004.
Wow.
We've been around.
Yeah. Yeah, so we always say we have combined clinical experience of 40 plus years, which is just alarming to say. But what we do with these summits is we get women from all over the world, and mostly it's women who hop on. And we expand the thinking beyond just you have fertility issues, you go to the reproductive endocrinologist or the IVF clinic. We think about all the bigger issues that are not addressed in those visits. And so we bring in experts in everything, experts like yourself talking about stress and the impact on hormones, the impact of resilience on can that help you get pregnant if we work on the emotional aspect. We have other doctors talking about markers for fertility. We have people talking about nutrition, people talking about what impact different ovarian regeneration therapies have, et cetera. So we just pull it into like a bigger thinking, and it really helps women who are under stress trying to get pregnant to have a direction to go. So we love doing these.
Oh, that's awesome. And I was so excited when I heard from you, because when I think about my own journey, I thought, gosh, I would have loved to have had something like this during that time.
Yeah, so you are just like us in that the people who end up in this field have had a challenge, and we just want to create what we wish we had. I was only 29 when I went to IVF, and people under stress and trauma. I had 5 miscarriages before. We just want to fix the problem, and maybe it wasn't the best decision for me. I did get a child out of it, but looking back, I didn't need to do that ever, because I got naturally pregnant and have a daughter who is 13 months younger than him. So that really spoke to me in that I never needed to do this to begin with, but all the work I did healed my body, and then I naturally got pregnant, which was sort of surprising.
Yeah. So does that constitute an Irish twin? I don't know what
Everyone
the time
says
is.
it, and they have freckles, and one of them's a little ginger when they were little, so they everyone thought they were definitely the Irish twins. But I think we were just so desperate and devastated after the 5 miscarriages that,
Of course,
we said, we better start trying right away. And it was like the first time, and all of a sudden this baby could make it to a full-term pregnancy. It was like shocking, but it just goes to show that your body wants to do this and there's other options. So that's what we want women to really understand. And one of the other things that I think is really a big deal here is that infertility or challenges with getting pregnant, it's really a marker. It's of future chronic disease potential. So if you are having challenges holding a pregnancy, like you've had some losses or getting pregnant to begin with, it's worth really looking at you, and if you have a male partner or whoever is, giving that sperm component, what are the health components for these people, and what does that mean for their future health? And so I think it's a really great way to think about it. Maybe these challenges with fertility are actually gifts for us to get ahead of future challenges, because when we dig deep, we find problems and we have solutions.
Yeah, I couldn't agree more with that. And now I have all these ideas and questions off of what you were saying, Dr. Kara. And Dr. Hillary, if you could share a little bit about what led you to creating this space for women to come and learn. And
yeah, originally it's the same kind of wound that a lot of women come to. I have polycystic ovarian syndrome. So I had a missing in action period that was given birth control for many years by male gynecologists. And at 22, I was told that I would be infertile. And it, just made no sense to my 22-year-old self. My 22-year-old, or 20, maybe I was 23. I was just like, this is ludicrous. I was on my way to become a psychiatrist, and just found out about naturopathic medicine through me trying to solve my own fertility issue. And it's just such the naturopathic medicine was the old school functional medicine in the way that it's being spoken about now, but it was the just trying to heal yourself, uncovering. I was a vegan. There were many things I was doing in my lifestyle that did not support my fertility. And when all of a sudden I learned about my hormone balance, got that online and on track, my body healed, and so did my desire for what I wanted to do. It was like, okay, I want to be in this line of work where we're trying to help problem solve and help remove what we call obstacles to cure. So if we see a woman or a man that's not quite on the right diet for them, have too many inflammatory factors, have environmental toxicants that they didn't understand, have some metabolic or biochemical dysfunction or dysregulation. If we're moving a few of these levers, can we get the body's alignment to heal, to want to have a baby? Because that's the thing, we are born to reproduce. And typically the world puts these challenges in front of that reproduction ability. And if we're moving the challenges out or correcting them, and it's never one thing, women are sometimes in search for the one thing. What is the one thing that's going to change it? And it's like, it's usually 5 things, or that if we just tune and change the dials, then that woman and man's or couple's ability to reproduce realigns and fertility is back in action. So we just get inspired by working with people. You have one couple who believes they can or has multiple miscarriages, and then all of a sudden they get to grow their family. I mean, that it's just almost addictive in the sense where you're like, we want to do this more. And also like supporting people through their pregnancy journey in their young families. And what I will say is there's no more prepared parents than parents who had an infertility journey, because they've learned so much about their lifestyle, about their diet, about their toxicants. Like, they're literally primed to be the best parents from everything that they've gone through. It's so satisfying when that happens for the patients.
I love your way of putting that, because it really reminds me of when you think of trauma work, the idea of integrating and the growth, kind of like the post-traumatic growth, because a lot of what both of you are saying really is resonant with my own experience, where I started with kind of more conventional medicine, which serves a purpose, not to say it doesn't. But excellent doctors, but they were looking at, again, I call it, say, PCO sister. But I also have thyroid disease as well. So you've got these two things happening. And then I also believe epigenetics plays a role. My ancestors were literally starved out of the Ukraine. And so you've got this generational trauma related to metabolic health all kind of colliding. And then you add the fact that I was working and getting my doctorate and like all these stressors at once. And so it wasn't shocking that it took the amount of time it took. And we went the conventional route, and I never got to the point of IVF, but I did like a round of Clomid. And I learned something about my body in that, because we did get pregnant, but we did miscarry. And I think that for me, this is not for everyone, but for me, what was happening when I did that round of Clomid, yes, making sure I'm saying it correct, is that I hadn't prepared my body and that egg, which, tell me if I'm wrong, but it takes 3 months to mature fully. Is that roughly correct? Roughly?
Yes, to be influenced, that we can influence the quality of the egg and the quality of the sperm for 3 months, for all the time before you're trying.
Right. And so I think what happened is that this medication came in and it kind of forced my body to become pregnant, which was what I wanted, but it wasn't with an egg that I had cared for in the way it needed for 3 months. And, I lost that pregnancy. And at the time it was shocking and it was traumatizing, which is something I would love to talk with you both about, is the emotional impact and getting through those peaks and valleys. But now that I know what I know now from what you were saying, Dr. Hillary, about that parents who have gone through this just know so much more, I reflect back and I'm able to say, okay, of course, that makes so much sense that my body wasn't prepared. But after I learned all of the things about what my particular body needs dietarily and supplements and stress management and all of that, then I was able to have my daughter, who is now 9. And so, but I ended up going a functional medicine route also, who I'm still with them. I'm all the different, ebbs and flows of life. I go to them, and I love that relationship. So I'm curious. I have so many questions. I want to ask, logistical questions first and foremost, because I figure some women, or even, hopeful fathers, are listening and thinking, okay, so I hear all of you. You've all had this journey. Where do I start? So how would you answer that? How would you get a listener kind of get their feet on the ground for this conversation of where do they start? And then what do they do if they have been going through? I almost call it like a monthly trauma of not getting the hope and the results that you're hoping for.
So one of the things that's exciting is that we do have this free summit coming up, and that's a great place to start, because you can start to expand your thinking on what resonates with me and where do I think my holes in my fertility plan are, and then maybe I can pursue those. So that's part of the vision, is sort of we get a bigger picture and you can see there are things to do beyond your OB or your reproductive endocrinologist plan. There's more out there. So that's a great way to start. For us, when we look at someone, we're really thinking about that connection between the heart and the brain in a really big way here, because fundamentally it comes down to that. And we're trained in Chinese medicine, traditional Chinese medicine. The brain doesn't really exist. It's actually the heart. And it's interesting to think about fertility in that manner, because if you're out here and you're thinking, I have hormone problems, my hormones just aren't working for me, there's something working against me here, it's worth looking at your heart and your emotional well-being, because in Chinese medicine, your heart controls your hormones. And so in our medicine here, Western medicine, we think, there's this area of your brain and it puts out all your, it controls, it's the master organ for controlling all your hormones. It's the heart in Chinese medicine. So I love bringing that idea to, am I paying attention to my heart, my gut instinct, when people tell me a plan, when things happen, does it feel right to me? And allowing that to guide some decisions, I think, is a really good place to be. Because when we're under stress, we do make poor decisions. It's just associated. There's study after study after study, right? It's just
Right.
the way it is. And so allowing the heart to take over a little bit is a nice place. So if you go to a doctor and they say something that doesn't seem right to you or they don't listen to you, that's not the right spot for you. So that's where we try to come in, is sort of say, okay, these are the things that are overlooked for you and what can we do from there?
When you say the heart, there's two different kind of avenues that my mind went down, and one is almost the energetics of it, because I would imagine as Chinese medicine stands, there are literal things that you can do to help with flow of energy. And then there's this other part of me that's thinking, if you have this couple and they've been going through month after month of frustration or trying and hoping, how to protect their hearts in a way where they still are working as a team. And also, I would say, obviously we probably all know that it's not just one person's trauma, it's both. But there is something so different about when it's happening to your own body. So also that kind of emotional aspect for the mother. So I guess those are my two questions. One, how would the two of you handle like energetic flow with the heart? And how would you handle the the weight or the impact of the emotional aspect between the couple?
It's such a good point, right? Because ultimately, if there's a couple trying to get pregnant, this is about their love and why did they come together to begin with, and what do they really love about each other, and can they enjoy their sex life again, and all of these questions come up. And so it's really beautiful to work with people, and then after doing this kind of work, they come back and say, our relationship is better, our communication is better. It's really nice when you hear that, because that's what this is all about. And unfortunately, it becomes about doctor visits and timing intercourse. We had a man who was so funny, and he said, "Oh, I get the text that she's ovulating, and I just want to run. Like, I don't even want to reply to that text." And it becomes that way for a
Yeah.
number of couples. Maybe people listening can feel that. So that's a really big piece of it, but there is no separation between all of what you're saying about the heart. So the energetic flow, the emotional state, I mean, sleep is determined by your heart in Chinese medicine
Ooh,
too. So
can you
it's
say
like
more on that?
on sleep, yeah,
Yes, and
it's
the
a lot.
heart.
So in early pregnancy, often women talk about their sleep is affected, right? Because their hormones have shifted. So this is all interwoven. And how stress, PTSD, these things show up in our sleep. And one of the important things about sleep from a Western perspective is those wee hours of the morning, 1, 2, 3 a.m. That's where we're processing what happened in our day and those interactions, and we're laying down the memories. And it's sort of a way that we're putting to bed those like lost thoughts in the back of our head all the time. And without sleep, we can't do that well. And so they recognized that after observing for thousands of years that, we can't have a good emotional state, a good hormone setup, a healthy immune system, all these things without good quality sleep. So they understood that connection with the heart. And anyone who's ever worried about anything can relate to this, right? We wake up in the night like our eye, we get worried about stuff in the middle of the night, and that will affect fertility.
From a trauma standpoint, and this is what I love about integrating like the holistic, the thousands of years of knowledge, and then really what's happened in my field, and I think it's interwoven with your field, is that now that we have the technology to see the brain the way we can and to see the way the brain reacts to certain things, I find it confirming. I feel like it confirms things that have been known for thousands of years. But something really interesting I had read before was that when you endure a trauma, so let's say you recently experienced a miscarriage or you had another month that didn't go as you hoped or planned, and that breaks my heart too when you have someone who starts, changing their life and planning their energy and their life and their relationships. And even, I have a client right now who has experienced multiple miscarriages, but is so hopeful that it's going to happen that they're still creating their nursery. We have this kind of like, if they build it, they will come type of hope. And I just love that. But it's hard to do that. And so the thing that I found very interesting is that when you experience trauma, one of the reasons why we experience disrupted sleep is because part of deep REM sleep, which is a big part of adaptive processing that happens with EMDR, which eye movement desensitization and reprocessing, for anyone who hasn't heard, it's the most robustly researched and supported trauma treatment out there currently, in addition to others, is that REM helps us integrate our memories. So to your point, Dr. Kara, it helps take the things that have happened either that day or that month or your life really, and starts to kind of reorganize, dust it off, and put it into an area of the brain where it doesn't have to be so acutely accessed. But then it starts to inform the way that our body responds and the way that we just see the world. So when we experience something that we don't want to integrate, right? There's this subconscious desire, like, I don't want to feel the pain of this thing that happened, even if we know we should process, but there's just that, kind of inner self that doesn't want to. It can actually cause disrupted sleep as a protective mechanism to keep those memories from integrating and to keep them top of shelf where they have to be continually processed or contained away. So one thing that I try to do with my clients who have something like that, they have a recent trauma, or maybe you experienced a miscarriage recently, is to do something for yourself that kind of contains that before you go to bed. And so that could be anything. That could be processing with a person. That could be jotting down, these are the things I don't want to think about tonight. I mean, it sounds counterintuitive, but it's almost a way of symbolically placing it over to the side so that you can allow for sleep to happen, even though in all honesty, doing that probably does help with processing. But I think that's another thing too, is recognizing, of course I have disrupted sleep. I just experienced a trauma. Trauma is a coping mechanism. These PTSD symptoms are coping mechanisms that don't always work well for us. And one of them is the disrupted sleep piece.
Yep.
So hearing your approach and your perspective from a Chinese medicine and how it really aligns, I think really supports with what, Western medicine is saying is really powerful.
And it speaks to the interconnectedness of the process. And so what we're trying to do with working with couples is like, okay, yes, on your genetic test shows that you have these, I call them holes in your bucket. If you're a cute little bucket and you were born with some holes in your bucket, there's that. And then if you've gone along your life, you and your partner, and I think that the partner concept is so important here because often it is definitely shifting. We love working with couples, obviously, however that shows up, but because there's two genetic materials that are coming together.
Yeah,
and
it's
they
not
both
just
matter.
right, absolutely.
And their story matters, right? Like your Ukrainian lineage, and if you're working with a male partner, their stuff, they both really matter. And it's great because men are coming to the table way more than even 5 years ago. Like that, the memo is out, and we've had even like men are bringing podcasts to their partners and saying, "Oh, I listened to this. I need to do this." But so there's this, what's in the genetics, what's in the epigenetics, and what's, like you're saying, what's in the processing of those things. And that's what's not happening at the reproductive endocrinologist. So that's where women feel cut off in the system. If they're going to their OB and the OB is potentially saying, well, wait a year because we're not going to do anything unless it's been a year. And that year can be a torture for that couple because every month they're experiencing trauma. And then they finally get to the RE and it becomes very clinical. And what we're all, I think, agreeing on is that it's a much more interwoven process than just what's happening in a doctor's office.
Can I jump off that one?
Yeah.
Because Dr. Kelley, when you were talking about the your ancestors in the Ukraine, it made me think about the Danish famine, the maternal study on, I think in one of the world wars, they didn't have food supply, and so the women were really starving. And when they were pregnant, so you could sort of track what happens to the genetic code by this starvation state of these mothers. And it was really interesting because the offspring, so these babies are born, and they're in this storage state, so anything they eat, they want to store, and they have all these metabolic problems and obesity and things like that. And so that's a really good example of epigenetics in that we really changed how these genes are expressed just by really starving the mothers. And so often Hillary and I will look at genetic tests, and these are not the genetic tests of your like karyotyping or offspring. This is not the one done at the fertility clinic. We're looking at genetic tests for health for the actual individual person, how they're absorbing their nutrients, what kind of exercise they should be doing, what kind of sleep they need, those kind of things. So looking at those tests can really help here. I think that's an area that should be expanding rapidly in the next few years because those genetic tests can really change the advice we give these couples trying to get pregnant and change the whole picture for them. So it really is looking at the health of your grandparents, thinking about what they endured. Did they have traumas? All of that actually plays out in trying to get pregnant, stay pregnant, have a healthy baby. And I think that's an area where you are recognizing it in your field because we're seeing it, if your grandmother had some trauma around this, we've got to deal with this.
Right.
And it's big and it can change everything.
I couldn't agree
A
more
woman,
because
oh,
sorry, go for it, Dr. Hillary.
So yeah, it's just while she's being carried in her mother's womb, her eggs are developing, right? So it is just this very direct imprint. Men are remaking sperm regularly, and those eggs, like when Kara and I were so old that when we were in school, we were told or taught that the science was that those eggs can't really be influenced or changed because what's done is what's done, and they're like continually degrading. And that was the thought when we were in school. We also learned that vitamin D was toxic. You just see how things change with information. And now what we really know is that, yes, our eggs were in our ovary and that we've carried them with us, but that we can absolutely influence the quality of that tissue. And we have women who at 38 have much better egg quality than they had at 33. It doesn't make sense on paper with the age, but that their fertility is improving as they're working through their traumas and generational traumas in their fertility process. Like, I just want to say one patient we have work with a woman who, when we first met her, she's a scientist. She knew everything. She understood exactly what was going on paper. Her lab value, she's extremely educated, and she spoke and she just really wanted to kind of stick to the science. And she was is working on her fertility, and working with her now, it's like she's opened up through her journey to realms of healing, nervous system support, repair, releasing, relational changes. Like it's her expansion of her life and her soul and her personality and her trauma healing it's literally shifted who she is. We get on with her and it's almost like working with a different person. And so it is this growth that you're being asked to step into on a fertility journey, but it's really where the magic happens.
It kind of sounds like a real life example of what you were both saying before about the heart and how if the heart is is controlled or tight or restricted in any way energetically, it feels and looks so different than if you open up. When you were saying she's very cerebral, it makes me think of clients I have who are trying to heal from whatever trauma. And if they only stay in that logic brain, if they're only in this energy, their body, which is actually a huge portion of the trauma self, gets ignored. And that's where things like interoception and proprioception, right? Being able to feel what's happening internally in your body. Am I hungry? Am I thirsty? Am I tired? For that interoception or that proprioception, where am I in space, really gets so impacted. And I can imagine how that would impact fertility, because I don't know about you, but I mean, I can feel if I'm ovulating now. Like there's definite signs and there's ways to connect with that. But if you're in trauma body, if you're in control body and you're up in that cerebral space all the time, it's hard to feel that. I had this memory from grad school. I was not trying to get pregnant at the time, but it's just such an aha moment. I remember I was finishing my dissertation. I was in my consultation course, and it was the last day, and I was late. So I had a boyfriend at the time. I was getting a little nervous about how late I was, because I was back when I didn't want to be pregnant. And I was finishing this dissertation, and I guess at the time it was a thesis because that was my master's, not my doctorate. But I'm in the class. I stood up. I took one step outside. This is the last class. I opened the door, and boom, my cycle started. It was like as soon as my body knew that I was done with that class, it was like, okay, now the energy can go. Now it can flow. And I just literally, and I remember thinking back, whoa, my stress totally impacts my reproductive health. I didn't call it reproductive health at the time because I was in my early 20s. I just thought my cycle. Right. But that was so wild to me.
There's so much that goes on with women. And I think this is the part of the fertility journey that where women feel kind of disconnected or cut off in these kind of shorter doctor's appointments, or things where it feels very analytical, or they're just kind of looking at lab tests, or they're timing their sex, because we are so intuitive and our bodies are doing it without our minds even knowing. I mean, it's like women getting in sync with their cycling when you live with women or you're around women a lot. There's just more to the story than we can process, right? And your story is like the same for the people trying so hard for fertility, and then finally they decide they're going to adopt, or they're giving it up, and they go on vacation, and lo and behold, boom, there it goes. They get their baby. I mean, we have families where it's like they adopted a baby and they had a baby within the same time frame. It just happens.
Yeah.
And I'll hop on that just to say that story you share about the impact of stress and your emotional health. So your emotional self imprints on your physical being. And so it really does. There's no separation here. And the research has been there. So one of the things that we find really important is that we really are into all the research, and we want to bring it into our patients right now. We don't want to wait the 20 plus years it takes for the research to make it into clinical practice. So we're really forward on that. And I think that's what's really fun about this work, is there's so much possibility. And we've known since 2010, really, since the NIH came out and said, women who have higher stress markers have a 23% less likelihood of getting pregnant. But that was from 2010.
Wow.
Why are we not out yelling this from the top of the buildings whenever a woman is having a miscarriage or having a hard time getting pregnant? And so since then, there's been study after study that confirms this. Yet we still hear people say, oh, that's not really linked. But it really is. And now we can look at all these markers and say, are you in this state? Because often we live our lives, we're just trying to survive our days, right? So we don't even feel stressed. We're just going through doing our things. So a lot of times people aren't even recognizing, I didn't know my body is under stress until you showed me those markers in the lab tests. And now I realize, oh, this is something to work on. So there's such a real connection here between stress and fertility problems. And there's the chicken or the egg, right? Are you trying for your career so much or having stress in your family life or whatever, and is that causing the problems? Or is it the other way around? You're getting your period and it's such a disappointment and a trauma every month, or you're having a miscarriage, or this is just a struggle. And sometimes it's the women who have one or two children already. And for them, it is the same trauma not getting that second, third, even fourth baby. It really is. So
Yes.
we need to recognize that they deserve this kind of attention too.
I'm so glad you said that because that is something that hurts my heart when you see, I mean, it's kind of a social media thing, right? You see comments from others, you already have kids, or why even try for more? Or why is it's just like every experience that you have individually that you want for your family is its own separate journey. So I'm so glad you said that.
Yeah, and I love it weaves so much in with the trauma work is that like some women are walking around, women and men, not even recognizing what they're carrying. And often the infertility journey is the first time where really a mirror is being held up and saying, oh, something's not working.
Yeah.
And these are the people we work with are very successful in general in many aspects of their life, right? So they've gotten into the hard schools, they've done the hard work, they do the thing, they get the PhD, they get the, they got the job, working hard. And then all of a sudden it's like, oh, but I can't get the pregnancy test to go positive, or I can't keep the
Yeah.
baby and hold a pregnancy. Like, it's the first time that they're really having to reflect and and acknowledge and process that, oh, something isn't working when I'm just turned on. All the on switches are on,
Right.
and having to relearn and process what stress is and how we hold it in our society. I just was in Bali and I
Oh
was
yeah, I was going to
working with
ask you
an
how your trip was.
intuitive there. Yeah. Oh my God. It was really beautiful, but I sat down with this intuitive, and I was the fifth American that he worked with. So I was the last one. And you could tell he's like, it hurts my head. You American women sit down, and it hurts my head how much your heads are working. Like, you guys are so in your heads that it's like, I feel it in my head. Like, can you just drop in to deeper? And we don't even realize the imprint of the culture that we're living in and how hard driving it is until you
Right.
go to another culture and somebody's like, ladies, like, you are like meant to be heart-centered creatures. And it's like, wait, what? Oh, okay. And that's the challenge and the gift. And so when women hear the message, what we're not saying is you just need to relax. That's not the message.
Good.
The message is, uh-oh, for women and men, we need to look at kind of the cultural overlay, the way we've been conditioned. What Kara's saying, that we don't even know that we're stressed. But we don't feel it. We know people who are anxious. We're not like that, so we're fine. That it's just this deeper, the shifting into a parasympathetic space, or the shifting into trauma release or healing, it's just a process that a lot of us have to kind of work through to understand, and that's a
Right.
key factor in fertility.
I'm thinking of a listener who maybe has experienced all the things we're talking about. They've either gotten pregnant and lost a pregnancy, or can never get the pink lines too, and they're thinking, okay, so I need to be less stressed, but every month that this doesn't work out, I feel more stressed. So it's my fault that I'm not getting pregnant because I'm stressed. I think there's this really confusing dichotomy of how much is within our control and how much can we really deeply impact, and then how much of it, I don't want to say it's just by chance, because I get this energy from both of you that you feel like there's a lot of empowerment. But I do feel like there's this gray area of people who may even be listening and saying, okay, I hear all of this, but I'm working all these hours, or I have this medical issue, or I have this child with issues and I'm trying to get pregnant again, and I can't just remove my stress. So how would you speak to those women? And also, I love that you said parasympathetic, because it's something we didn't even talk about yet today. But are there any specific exercises or things that you love for women to do to help with that? You said 23%, Dr. Kara, that stress is found to impact, and it's probably more, but that stress is found to impact fertility. Like someone who really wants to walk away today feeling like, okay, I get it. I should be less stressed. So how do I do that? How do I deal with that after I turn this episode off today?
I love the question. I'm jumping in. I know Hillary has some things to say for it too. This is what it's all about to me. We have this challenge, and Hillary was saying earlier about the people we typically end up working with, because you have to be highly motivated and find us and get in our schedules. It's not forward, right? It's not, the first call is not to us. So the women we work with are typically the trickier cases, and they are problem solvers. They are trying to figure it out and highly motivated. So I would encourage anyone listening to just hear this. Your body is made for this. Your body's made to heal. There is something missing from your picture. So there is a hole in the bucket, like Hillary said, or we are just there. We need to turn over every stone and leave no stone unturned, because I feel like there is something happening here. So I don't think it's that we're cursed. When I had the 5 miscarriages in my 20s, I remember feeling this, and I grew up listening to fairy tales, so you have to forgive me, but I thought I was cursed. I really did. And I just felt like, why isn't this happening for me? I did something wrong. There's something that I caused this, and it was this self-blame and this horrible situation. And, Hillary was my dear friend at the time and didn't even know anything about this. So I kept it all to myself. So don't be like me. Don't keep it all to yourself. Get support, get people to help you, talk to other women, sit down. I really think it's a problem in our society that, you don't sit at a dinner party and say, I just had a miscarriage. We don't do that. But we have friends who have had losses. There is no doubt. You and your text thread have some people. So just reach out, talk to a few people. You are not alone. This is the thing that's really important. I think that's the first step, making sure you're not trying to do this alone. And the next thing is knowledge is power. So for me, it is getting the proper team, getting the proper blood work done, working on your nutrition, really leaving no stone unturned, and likely things shift. So that's what's the really big piece, is every decision you make in your day today could potentially impact your fertility, from the shampoo you choose to what you eat for lunch to who you talk to. Do you need to not get that phone call from the person who causes you stress and gets in your head? All the decisions through your whole day could impact fertility. So let's get a plan together and really push that forward, because your body knows how to do this. So I think that's the message. It's not one trick for every person. Right. It's figuring out what's going to work for you.
And I feel like, and I would love to respond to you specifically first so that I don't forget, what you just said meant everything to me when you were saying that we don't talk enough about fertility just in our culture. I absolutely would love to obliterate this first trimester needs to be over until we talk about our pregnancy culture idea that we have.
Right.
And it's okay. I mean, if that's something that you as a listener, or you as a woman, or you as a person prefer, that's fine. But I will say that first miscarriage I had, it fell around Thanksgiving, and we were super excited. We wanted to do like an announcement. So I was only 8 weeks. And then someone probably could judge and think that's too early to share. So we shared our pregnancy on Thanksgiving. It was, just Facebook only. I don't even think Instagram was going at that time. And then a week later, we found out that we lost the pregnancy. And it fell around the time where I remember a Christmas party was happening that I was invited to. And I was literally in the process of like waiting for my DNC, like that kind of gray area where you're not pregnant, but that is a terrible space to be.
Terrible.
And I sat with my husband and I was like, no one would go to this party. Like, no one would go. Like, I'm literally going through a miscarriage. I've been weeping for days. And something in me, it was just so bizarre. I felt like someone else lifted, and it wasn't him, lifted me up out of the couch, put me in the car. I didn't even know what was happening. And like all of a sudden I'm at this party. Like, and I wasn't my normal self. Like I wasn't kind of this energetic, jovial person. I felt very flat. And I almost remember thinking, why am I here? Like, what am I doing here? And then my friend Billy, who is now one of my best friends, who I didn't know at the time, walks up and he goes, "Hey, I'm Billy. How are you doing? What's your name?" And I just looked at him. I remember I was like blinking and I go, "Oh, I'm going through a miscarriage right now." It was just like, it just like tumbled out of my mouth. And he looked at me a little stunned, obviously. And then he held space for me and he listened to me and he was compassionate. And it was the start of an amazing friendship because I was so raw and authentic. And it was like the second I said that, all these people were there. You know, they didn't force themselves into that healing bubble, but that, I feel like, in my opinion, was such a big part of my ability to then I got pregnant very quickly after with my daughter, who is now here. And I feel like I needed that as far as like my energy goes. If I had done what you were saying, Dr. Care, of keeping it all constricted, I don't think the healing would have happened. Now, I don't want anyone listening to think that they need to go to a party when they're in the. I mean, it was such an out of body experience. I don't even know if I consciously made the choice. I just kind of automatically did it. But even if there's a person outside of even just your partnership, I think it's helpful because they also are going through a trauma. So having someone outside of that who can hold space for you, even if it's your parent or someone, like, I don't think we should be so hyper protective of other people's feelings about us having a miscarriage that we're protecting them and not telling them because we don't want to disappoint them.
Right.
You have hit such a note for me, and I appreciate you saying that.
And it's allowing for connection and
Right.
expansion and a joyous experience when a human being's holding space for you.
Yes.
And I feel like sometimes what's happening is there's an absence of joy in the process and a disconnection from the heart, just circling it back to the heart.
Right.
And what happened in that moment was your heart was held. And so the more that we can, the heart is what experiences sadness, the heart also experiences joy. And the more heart can be brought into the process, and I'm not saying that people don't have heart that are struggling, but I think that there is always room for an expansion of joy. Kara and I will sit with patients and we're like, okay, tell us what you do in your week that brings you joy.
I love that.
Is happiness on the table for you in the week? Is it a goal? Is it something that you believe you deserve? Like, and joyfulness, resonance. And that's where sexual connection, that's what it's supposed to be, right? It's supposed to be a place where bodies come together, joyful, heartful, and like there's this like synergy and connection and magic. So if the joy in your life is actually lost through this process, which it's very easily done because it's so scientific and reductionistic and all the things that are like the anti-joy, then yeah, maybe you're taking the wrong form of B12, but you're also like where the medicine's really going to penetrate is if your heart is open.
Absolutely.
And if your heart is doing something, you taking the right things is almost less important than you feeling the right way, connecting in nature, exercise, moving your chi, opening to a friend, feeling love, connecting with your partner again if things have been shut down. And like that's part of the magic and the medicine in the journey.
I love that so much. I have had such a good time talking to you ladies, and I really want to stay connected. Like, I really do. I feel like there's such this beautiful, cohesive thing that can happen with the mission you all have. And I'm curious if you can think of any last thing that you would just love listeners to walk away today, knowing about the next step for them, and maybe also where they can follow the summit, follow your work. And I don't know if people can work with you across state lines. Maybe you could explain that a little bit.
Kara.
So the last thing I would want to leave someone with, if you're listening to this and likely you've been on a fertility journey, one of the things that just hits us when we're working with individual women is this idea that they feel broken or that their body is working against them. And I just want to say, if that is something that you're like, yeah, I kind of do feel that way, then I just want to help you to know that that is not the case in any way whatsoever, and that your body's giving you signs like a miscarriage or not being able to get pregnant or not ovulating. Whatever that sign is just your body giving a sign of there's something going on that we need to fix here. And it's worth trying to figure that out. So I'd love to reframe that in your head of like, there's something wrong. I'm going to figure out how to fix it. That's a great way to shift this thing of this is the opportunity to get in there and really get healthy and get in a good state of mind. And the other thing is the summit is a great place to start. And if you want to hear more conversations like this is what the summit is. It's interviews with experts like Dr. Kelley, who are really forward health thinking people who are just like questioning the norms and really thinking outside the box. So hop on the summit. Hillary and I work with people from all over the world, and we'll work as consultants. So if we're not able to be your actual doctor, we'll be your consultant, right. And we'll give you a list of the labs and what ranges we're looking for, and people will work with their doctors in Europe or doctors in Australia, and they'll get those things done. So we're happy to have that kind of role for you. And if you're in certain states, we can be your actual doctor. So we're happy to work with anyone trying to get pregnant to give them some direction on these are the areas where we want you to really spend some time and effort and resources. And the last thing I'll say is that it's never too late. So that if you're listening and you're feeling like I'm too old for this or whatever it is, it really is interesting that, when we first started doing this work, we were surprised too, but it's not necessarily about age, it's about health. So really interesting to think that way and start like getting rid of those stats and those numbers and just thinking about I'm going to get ultimately as healthy as I possibly can and see what can happen here. So I hope that helps you. And thank you so much, Dr. Kelley, for having us on. This is a really, we're all talking about the same thing really in just different areas.
Absolutely. I love that. Thank you for that. And Dr. Hillary, what about you?
Yeah, I loved being here. Thank you so much for having us. And anytime we could collaborate, I'm a big yes. When
Awesome.
Dr. Kara and I came together to do this, I think we were both like seeing that a team approach was really important for these what we would say is trickier cases. Like we said, we tend to work with people who have had unexplained infertility, and unexplained just means like we just haven't figured it out yet, people.
Right.
Like it's not that there's not an explanation, like we just have some levers to turn. And that's why we love working together, because we were trained together. We both trained as naturopathic doctors and acupuncturists, but we went off and did our own things and learned our own things. And so when we're working together with our patients or clients, like it's very, we have very unique perspectives and insights. And then we always sort of insist that even if you think you have the most perfect diet, you'll learn something from our nutritionist and learning a little bit more. And even if you feel like you've been on the most supportive spiritual journey, working on your parasympathetic nervous system, working on healing this trauma, working on bringing up your joy, that these things all should be happening together, and that bringing together a team for this is a really important part of the process. And that's what we love with the summits in a way, is we're bringing together a lot of different providers. So what we hope is that people go, oh, person's maybe missing in my life. Oh,
Right.
I need to do more trauma work, and I can listen to Dr. Kelley a little more. Or, whoa, I didn't understand that about my biochemistry. And so that's what we're just trying to do, is spark a little bit of like, whoa, that's interesting. I haven't heard that. Could that be happening for me? And that the more we're, like you said, talking, communicating, expressing, sharing, working on it together when it's out in the collective, you're cultivating your seeds. That's what we're cultivating your seeds of fertility. It's an active process. Like, so that's what we kind of invite you to engage in, the active process of your fertility.
I love that. And my favorite thing about both of your messaging and everything I'm picking up from you is that as someone who has gone through this, and if you're going through this, I think one of the most important things is feeling like your doctor or your provider believes in you and will continue to think outside the box and continue to explore and search on your behalf. And I definitely get that energy from the work you're doing and what you're putting out there. So thank you so much for coming on the Sensitivity Doctor. I'm so excited to continue collaborating, and I hope that, someone listening gained some ideas or some clarity or a little bit more hope from this episode. So be well, everyone.
Thank you so much for having us.
You're welcome. Yeah.